Good morning, everybody. Welcome to the second annual Patient Day in the National Thrombosis Week. Many of you know Lifeblood, the thrombosis charity, and what you may not know is that we have changed our name to Thrombosis UK, but our mission remains unchanged: to raise awareness of thrombosis, to fund research into thrombosis and the treatment of thrombosis, and to promote improved care for people who have suffered thrombotic events. We often hear from bereaved friends and relatives who have had lost a loved one to thrombosis, but more often than not, we hear from those who've recently been diagnosed with thrombosis and who are struggling with the physical and psychological after effects of the problem. DVTs and PEs are devastating to individuals. Thrombosis UK has a lot more to do than it has already done. So often diagnosis is very slow in coming. So often a referral to a hematologist takes weeks or months. So we have secured mandatory risk assessment for thrombosis in hospitals through our efforts over the years. But we have a lot more to do, as I've said. Lifeblood wants to change the way in which thrombosis is regarded nationally. Patient days are a really important part of that process of raising awareness and providing information and support to all of the people here and all of the people out there that we have yet to reach. I know you'll find our speakers very interesting, illuminating and informative, and hope that in the meantime you also have an enjoyable day. Now I hand over to Professor Hunt.
So thanks very much, Shelley. Shelley, as you know, is chair of our trustees, and I'm Beverly Hunt, and I'm medical director of Lifeblood now, Thrombosis UK. So the whole point of this day is for you, the patients, and what we have organised is a set of talks from really eminent speakers, and then afterwards there is time for you to ask questions. Please ask questions. You are allowed in this setting to ask those questions that you've always been scared to ask, and now's the time. We don't mind how odd you might think the question is. I'm sure it's relevant to everyone else. So we'll have a series of talks through the day, and then in the afternoon we have a couple of workshops that we hope you will participate in, and another chance for you to have a chat and to get more information.